Good afternoon, everyone. My name is Brittany, and I am back for this week's installment for the Here with Families, Here for Families, Raising Special Kids Facebook Live. I am happy to be here today, and for those just jumping on, I know you probably just saw that notification in your timeline that we are on for our 1 p.m. Friday Facebook Live. Again, my name is Brittany Miller. I'm with Raising Special Kids, and I've had the pleasure of hosting this along with several of my other colleagues over the past several months as we've all been quarantining together. So for those just jumping in, today we are going to be talking about mental health tips. So hello, thank you for saying hi, Brianna. If you guys are jumping on and you want to say hello, please feel free. The great thing about these Facebook Lives is they're very interactive, and I want to see what people are commenting on, what resources they're sharing, because we're all in this together as we raise our kids with disabilities. So for those that have never joined on one of these broadcasts before, we do them weekly. Ever since COVID hit, we really wanted to find a way to continually connect with our community. And since right now there's not a whole lot going on physically for our outreach events and things, Raising Special Kids, we've adapted virtually. So now we are doing outreach events via Facebook on the Spanish and English pages. We're also doing our virtual trainings, which I'm sure many of you are registered for and have taken. And we're really trying to continue those community connections. So again, thank you for jumping on. Today we are talking about mental health tips. Now, I just want to do a little disclaimer. I am by no means a counselor or a psychologist. I am a mother, like many of you listening in, raising a child with disabilities and medical issues, as long as other children in our family, and I feel stress about this pandemic as well. So the information I'm sharing is tips I've heard from other moms in our Arizona community that I've gathered. I'm also going to be talking about some things that have worked for me. And then I do have a great resource I'm going to include from a clinical psychologist named Desiree Dixon that she just gives she gives 7 tips that are super relevant that I think our listeners will really take to heart. So let's be honest here. Coping with COVID has been unquestionably challenging. I don't know about you, but I'm going to admit it. When I heard the governor's announcement that school wasn't going back till the 17th, I did shed a few tears over it. I am fully supportive and thankful that our society is protecting each other. I have a medically fragile daughter, and we wear masks in this family, and we wash hands, and we social distance. So it's not about that. It's not about the knowledge that we need to protect each other. It's the knowledge that this is ongoing and it's long. And I think the hardest part really is there's no end deadline. If we knew, okay, well, we're only gonna have to cope with this until October officially, maybe mentally it would be a little easier to wrap our heads around. But it seems like so many parents, including me, are just on edge every time I hear that there's going to be an announcement from the governor, like yesterday, about some breaking news. I kind of get tense and hold my breath and think, oh, what now? What's going on with our society now? And all of that can cause anxiety and be wearing on our mental health. So I hope today some of the ideas I'm sharing can be relevant to you, can bring you some guidance and hope. And again, if you need legit medical attention, if you need to talk to a psychiatrist or someone, if you have depression or something very serious, please do it. If you need a reference or a resource, Raising Special Kids, we have a mental health provider list that we've collected. A couple years ago, Phoenix Children's Hospital, they had a project where the Family Advisory Council, I happen to actually be serving on this particular council, they worked with the psychiatry department, and we called so many providers in the community providing mental health services, and we vetted them, and we find out, which ones do evidence-based practices and which companies are reputable, and we gathered a big list. And so if you're having a hard time getting into some of our local children's hospitals for appointments for psychiatry for your kids, call us, because we have some resources we can pass on to you. And today I'm mostly going to focus on mental health tips for us as parents. But of course, if you need any advice on where to go and what to do for your kids, call us. That's what we do. And I'll just say real quickly, our number is 602-242-4366. So hi, Dolores. Hey, Evan. Hi, Kathy. I see a lot of people are jumping on and listening. Thank you so much for listening in. So a Raising Special Kids update. Let's see really quickly. I always like to give an update on what we've been up to lately. We have been doing virtual trainings, a lot of them. We've been helping families with guardianship or understanding, all those options for when our kids turn 18. So power of attorney, guardianship, SSI, we have a training on that. We have an IEP class that we offer regularly. And honestly, parents, would be a very good one for you to sign up for, given we're heading back into distance learning. And we want to make sure you're comfortable and empowered on understanding the IEP process. And as always, we're here to help walk you through that if you need support. We have a really exciting event coming up Saturday, July 18th. It's our Transition Institute. So every year for 5 years and counting, Raising Special Kids has been collaborating with community partners and creating this Transition Institute. Now, normally it's in person, and of course it's a little bit of a bummer that we can't do it this way this year, but we didn't want our youth and young adults and their parents to miss out. And so our director of programs has been working hard, and we have this wonderful community event still going. It's Saturday, July 18th. Head over to raisingspecialkids.org under our events and training section, and we have the registration there. It's free, and all throughout the day there will be topics like employment or planning out a good life. What is possible for our young adults with disabilities? A disability can be ability, and we don't want families to feel like just because their child may have a diagnosis that they can't have meaningful employment, or that there's not as many opportunities, because they're out there if you want them, and we're here to help you find those. And some of our wonderful partners in the community are going to be there talking as well. So that is my plug. Please, please register. Transition Institute is wonderful, and it's so inspiring for our youth to attend. So that is something we're going to be doing. Something else to look out for is we are going to be having on Friday, July 31st, we are going to be hosting a back to school Facebook Live. So we are getting tons of questions. We're learning new things every day from our Department of Education and our government leaders, but we are going to have a back to school Facebook Live giving you some tips and guidance on how to approach distance learning 2020 school year. So I know we got a little taste of it in the spring, but now we're moving forward, and kids are going to be really going full force into distance learning, and it's not going to be easy. We're doing it with you guys. We have children here at Raising Special Kids as well, but we're here to support you. So again, please call us. We are happy to help. So moving forward, I just wanted to talk about some mental health tips that I have gathered. Before I get to the guidance from a professional, I wanted just to talk about what I've been hearing in the community. So thankfully, I belong to some wonderful medical mom, special needs and mom support groups for Arizona. And many of my colleagues do as well. And honestly, many of you do as well, listening in. And people are, talking with each other and kind of commiserating together, also providing tips and tricks and just being there for each other. And honestly, that is a form of mental health support for me in itself, is having others who get my life. So that is huge. And I asked a question recently on several of the groups on, what things are you doing to help you cope during this ongoing pandemic? And there were tons of ideas. Some of them were, pretty standard, trying to take a break, going on a walk, even though it's hot, getting out into nature, trying to squeeze in a nap somewhere, reading a book, Diet Dr. Pepper or chocolate, just the typical little things that us as parents and moms especially like to do to make ourselves feel better when things are hard. But there also were some more serious some more serious issues and guidance, whether it be utilizing teletherapy or calling a crisis line or connecting with another parent who has a disability. Their child has a disability similar to your child, and that's something we can help with our parent leader program. Those were more concrete and legitimate ways to help moms cope with the mental exhaustion of this continued quarantine. And it just really made me realize that so many people are suffering. I am not an expert on statistics, but I have noticed, you read, if you do the scrolling in social media, you read that suicide rates are up, and that this ongoing COVID-19 pandemic is really affecting people mentally, and that's serious. And if you need that type of assistance, if you're really struggling, please call 911, please call a crisis line, please call your physician. Take it seriously. This is a national crisis. None of us were prepped or trained for this, and it's okay to admit you need help. So I just wanted to say that, some of the tips I share, like taking a nap or getting a shower in, are not going to do justice for people that have true mental health conditions. But if you need help, there is support. I'm really grateful our government leaders and our state has put some programs in place to help. And I did pull one of them up because I wanted to make sure I gave you the correct information. And I will be posting in the comments the links to this. But there is a program via 211 Arizona, and it's called, let's see here, let me pull it. It's called Resilient Arizona. So it's federal funding that goes for crisis counseling, specifically for COVID. So it's a federally funded program, and I pulled it up so I could read you the details on it. So it's there's counselors all over the state that you can call and get free crisis support. It is free, and they do it in Spanish and English. I'm going to post the contact info, but some of the things that crisis counselors do, and I pulled it up because I wanted to share with you, they help enhance social and emotional connections to others in the community. They talk to you, they work through your problems with you. They help teach you coping strategies and resilience. And I think most importantly, they let you realize you are not alone. There are several centers and organizations that are facilitating this counseling. Many of our families at Raising Special Kids, we refer them to Family Involvement Center because they're great. And Family Involvement Center is a resilient 211 provider. Other organizations, Impact, La Frontera, the Guidance Center, RI International, all of them are offering free crisis counseling from 8 a.m. to 8 p.m. 7 days a week. So I will post the details when I'm done talking about this invaluable resource. And if you need it, please use it. That is what it's for. Our state has realized the need for it, and our federal government has provided the money. So if you need that assistance, it's there. Also, many of you, if you call your health insurance plan, most plans now are approving teletherapy, given the world we live in right now. I have a daughter who has several appointments, and one of my children has ADD and anxiety, and she has done telehealth with her psychiatrist, and it's fabulous, and it hasn't cost us any extra money. And honestly, they've been almost more accessible because their schedule, they can, see more patients, and we don't have to worry about the commute. And I know there are also counselors who will do telehealth services. So, those are ways that you can get mental health support, and we sure need it. It's hard enough to raise a child with disabilities, to be sleep deprived, to have a child with high medical needs. I understand that one. And to deal with that daily strain, and then put on top of it a pandemic with we're all home together. There's no end in sight. We're facing another year, another semester of distance learning, hopefully, or maybe not hopefully, but we're going into another season of distance learning and trying to follow our children's IEP and trying to work from home and be a teacher and a therapist and a house cleaner and a chauffeur and all of the things that parenting brings, and then throw in the stresses of what we've been going through these last long months. It's hard. And so please, if you need help, get it. And there are resources available. And if you would like to talk to someone from our office and we can connect you with those resources, please call us, our family support team. We're ready and willing to help you. So I did also want to share, this was a wonderful, wonderful article that I found, because honestly, preparing for this Facebook Live has been pretty therapeutic for me, because I'm a medical mom. I have a lot of stress, and I'm with you guys. This has been stressful. And so being able to take some time and really think about mental health has been good for me too. So I have my resource, and I want to read straight from it, because I am not a psychologist, and some of the guidance that Desiree Dickerson gives in this is invaluable, and I don't want to misquote it. So the first tip she gives in managing your mental health is know your red flags. So one way to manage moments of distress is to identify key thoughts and physical responses when you know your anxiety is coming. So everyone handles stress differently. For me, my mind will start racing. So I will fixate on something and I can't let it go, and it legitimately will keep me up at night. Or maybe someone gets, short of breath, or they get a headache, or they get, feelings of worry, frustration, sadness. Those can all be red flags, and you know that something is coming on. So to address those, some of the tips she says, obviously besides getting professional help, is, breathing techniques, calming, meditation. And honestly, I didn't really understand the value in this until COVID, because really, before I was in this national crisis, I didn't really take advantage of meditation, and admittedly maybe didn't really understand the value in it, but I have now. And using, there's so many free meditation apps online. Calm, if you go to Calm, I think just calm.com, during COVID, they've offered their sources for free. At ASU, they have a mindfulness center. If you go to their website, they have like a daily mindfulness YouTube video they post. There's a wonderful local organization called Dames for Special Needs Moms. And I believe during COVID, they're offering some free resources as well. We live in the age of technology, and there is help out there for these types of things. We actually, as a Raising Special Kids team, at Christmas time, we always have a all staff meeting, and it's a day of education, but it also is a little holiday celebration too. And our wonderful team treats us to something special. And we actually learned from a local woman, her name is Jenny Brackman, about some of these physical things we could do to cope with our stress. And Jenny, if you happen to be listening, I know you love Raising Special Kids. I'm using some of those, and so thank you. So don't discount some of those ways that you can help yourself mentally. YouTube has a ton. Brianna, thank you for commenting. She said that her child likes to listen to some, let's see here, some voicing sessions to fall asleep to. And thank you for the reminder. Brianna says, parents, remember to honor yourself and your children and your family, because we need to take care of our mental health so we can take care of our kids. Thank you. That is so true. And I appreciate that feedback. Okay, moving on. Routine. Routine is your friend. And we have talked about this a little bit before in past Facebook Lives, but having a schedule in your day, even for your kids. So getting up at a decent time, going to bed at a regular time. It's hard to get up and get motivated or feel like we have to have a schedule if we're just endlessly at home. We don't have to worry about getting people up for school or a work commute and all of those things. But endless days of no routine does not feel good to your mental health. So to fix that, set your alarm to go to bed, actually. Don't let yourself stay up till 1 a.m. watching Netflix or doom scrolling on Facebook. I heard that comment recently from another mom in the community, that sometimes scrolling social media is like doom scrolling these days because there's just so much negativity. There's also a lot of good, but there's also a lot of COVID everything, and sometimes we need a break from that. So find something else to fill your headspace with, and don't always focus, and keep some sort of routine in your day. I promise you feel better. You will. Another tip is to be compassionate with yourself and others. So there is not a lot we can control right now. If that is something I've learned from COVID, is I am not in control, and I have to go with this situation. This is fluid, and many of us are literally day by day waiting to hear what's going to happen to our economy, our schools, our employment, just life in general. There's a lot we can't control. And so just focusing on the day-to-day can be helpful. And also giving ourselves a break. This is hard. In all my years of parenting, I never expected I'd have to be a mom during the years of pandemic. I hope it's not years. I should rephrase that. During the months of pandemic, excuse me. That is something I'm not hoping for. But the feelings of being overwhelmed or feeling, I can't do this, this is too hard. Try to be kind to yourself. Our executive director today shared a phrase that I'm going to forever remember called a hope dealer. So he said that he had listened to a presenter that talked about, are we hope dealers? When people interact with us, do we distribute hope? Or are we taking away hope? And I had to kind of self-check even myself, because often with, my kids, me complaining that, this is going on still, and them hearing my sadness over, them missing out on school, or even the parents that our Raising Special Kids team interacts with every day, we want to be positive. We know this is hard, and we get it. We're in it with you. But I loved the idea of being a hope dealer instead of a hope stealer. And I'm going to keep that in my mindset moving forward. And also ask for help. Like I said, there are resources and people who care. So don't forget to ask for help. And I bet if you do, you will get it. So many of us are afraid to ask, or we may feel ashamed for feeling these feelings of despair, but I know full well that we're not alone in feeling this way. Another tip that she shares is maintaining connections. So just like me and the audience I'm talking with right now, we can connect. I can't imagine going through a pandemic without having social media. I am so grateful that there is Zoom and FaceTime and Marco Polo, and all of those things are free, and we can have connections, and we can help our kids do that. It's important. Human beings are social creatures, and while we're living in a time where we may not be physically together, for our mental health, we need to find some way to connect, even if it's over the phone. Another tip she gives is manage your expectations. Do not understand the cognitive load that this pandemic brings. Just give yourself a break. As we head back into the school year and our kids are distance learning, I didn't go to school to be a teacher. I didn't get a degree in special education or counseling or speech therapy. Of course, I'm going to do my best for my kids, but I'm also going to try not to be super hard on myself if this isn't something I'm perfect at. And I do feel, and the feedback we've been getting from our state leaders in education and the Department of Ed and our school districts, is they realize this is hard on us, and they're here to help, and they're compassionate and understanding. So just go easy on ourselves. I know we've been doing this for a while, but it doesn't get any easier. We're just going to keep moving forward and social distancing and trying our best to keep society safe. But in the meantime, we have to find a way to cope and be happy. I liked this one. She said, proactively manage your stress threshold. So try and lay a solid foundation for your mental health by prioritizing sleep, which I know not all of us get great sleep, but we all can go to bed earlier. That is something we can do. Eat better. Obviously, I know sometimes emotional eating is an easy coping mechanism, and guess what? I do it too. But really, legitimately, if we drink more water and eat healthier, we're going to feel better and perform better. Exercise. I know it's hot right now, but we live in a state where nature is not that far away of a drive, and we can get out into the cooler weather. We can go swimming. Just find a way to move your body and to eat better. There's also so many creative social groups, online book clubs, coffee groups over Zoom, coworkers, including us and teammates. We're meeting together virtually, and just having that bit of social interaction really can uplift your spirits. We may be in social isolation, but just remember, we're not alone. We're not. Her last advice out of these 7 tips was manage uncertainty by staying in the present. This is something that I admit I am not good at. I always like to think 3 steps ahead. I'm a planner, and I know many parents who have special needs children, we're wired that way now. We have busy lives. We have kids with, 5 hours of therapy a week and ABA therapy and 16 specialists at the hospital, and we have to plan. We live by our day planners, otherwise we'd be lost. But I've learned something big from this pandemic is sometimes those plans go out the window. And yeah, it affects my mental health and makes me stressed. But if we just, take a step back and look at the big picture and kind of self-coach ourselves through that, it will definitely help. And I wanted to read her quote. She says, "This will probably be one of the most stressful times for all of us, and it will test the mental health policies and practices of many research institutes, just as it is testing much else in the world. By embracing good mental health and well-being measures and relying on others when necessary, we can protect ourselves and others around us." And I just loved that. COVID-19 is rocking this generation. There are so many interesting consequences and realities that are coming out of this social distancing time, and we're all learning and growing from it. And it is affecting our mental health, and it's hard. But I know we can be there for each other, and like the common phrase, "We're all in this together." We really are. And I just wanted to close by saying, we realize that many people have depression or anxiety or true mental health disorders that need professional help. Please get it. If you don't have a resource, call our office and we will get it for you. If your kids are really struggling, call, and it's very dangerous and real, call 911. Take them to the emergency room. Utilize this crisis counseling through Resilient Arizona. There are more things. This is traumatic for all of us, and we're all learning together and how to grow. And I hope you can take some of the tips I've shared today to heart. You know, be easier on yourselves. Find one small way to find some control in your day. I promise it'll make you feel better. And try not to think too far ahead. Organize your time. Maybe go to bed a little earlier. Connect with people. Talk with a friend. There are countless ways that we can get through this together. And as always, the team at Raising Special Kids, we are here for you. You can go online to raisingspecialkids.org and refer yourself. If someone listening in has a loved one with a child with a disability that needs someone to talk to, call us. We can help you. We have a wonderful parent leader program. If you are really feeling stressed about your child's maybe new diagnosis, maybe they were diagnosed during this pandemic and you're feeling especially alone, call us. We have wonderful parents we can connect you with for emotional support. And when you call our team, you know that you'll be talking to someone who's touched by a disability. All of us, or many of us on our team, are raising kids with disabilities, and we have these same thoughts and feelings too. And we're here for you. So again, our office number is 602-242-4366. Please stay safe and be well, and have a wonderful and hopefully somewhat peaceful weekend. See you next week, everybody.